Good, we're recording. I have to buy dollar store reading glasses that I can see my own slides at this point. I am Brian Dowd. I'm the Deputy Executive Director over Policy Operations and Compliance here at the Department of Community Health. And I really want to thank you for joining us for the Medicaid Fair and specifically for the EVV presentation at the Medicaid Fair. I learn a lot from every single presentation I have, and what I hear from the provider community and the member community helps to inform and move forward the electronic visit verification system. Let's go to the next slide. So we always start with the mission of the Georgia Department of Community Health, which is to provide Georgians with access to affordable quality health care through effective planning, purchasing, and oversight. Next slide, please. What are we going to go over today? We're going to do some quick member updates. I know usually at the Medicaid Fair there's not members, but I made a commitment a little ways back to always start with member updates, and so I'm going to do that now. I'm going to give you just general project updates. I'm going to give you some EVV training resources, talk about some common issues or denials, talk about the town halls we've had, give you a third-party update, and then we'll do a Q&A. Next slide, please. So let's talk about access updates. So this is important for our member updates section of what the presentation was going to be. So one of the things that you need to know for your members who are, if you are a provider or if you are a member who's on the line today, is that you have access to a free phone as a Medicaid member. So Medicaid members have access for a free phone who need a smartphone. A lot of times I hear from providers, hey, my aide doesn't have a phone that can download the app to do EVV, or my aide doesn't have any minutes on their phone, and I need some other way of my aide signing in and signing out. And we do have an option, if your aide doesn't have the phone, that the member can use IVR or telephone in the individual that they are servicing's home place in order to check in and check out. But sometimes that's an issue too, and home places don't have a landline that they can use. So this is a solution for our members and you as a provider. Members can get a free new smartphone through Georgia Lifeline. They can download the app with EVV. It is fully compliant with our EVV solution. They get unlimited text and unlimited talk, and that's so that they can do things like make doctor's appointments and follow up with text on their doctor's appointments. And then they also have free internet access to the EVV application. You know, when you use your phones, a lot of people, when you use your phones for Wi-Fi, you have a limited number of minutes you can do that. And these phones have that same thing. But the EVV application does not count against your usable minutes. So even if the member were to use all their minutes, they can still use that Lifeline phone to check in and check out. That member could put the Lifeline phone next to their front door, next to their bed. They can keep it on them when they go out if their aide is meeting them in the community to start a shift. And that aide would simply use the member's phone to put in their ID and their password, log in and log out, and then give the phone back to the member. The member would then, when the person clocked out, allow that aide to use the phone to clock in and clock out as well. Next slide. So let's go over a little bit of project updates. So where we are with status of EVV. So effective November 1st, 2021, we are requiring that all EVV claims be submitted through EVV, through NetSmart or through your third-party vendor to EVV. After November 1st, you should not be submitting claims directly to GAMUS unless there are a few instances where we will allow you to do that. So next slide. So here are some of the reasons why we moved forward to 11/1 date. We had some concerns The number one concern is that some of y'all were missing prior authorizations. The number two concern was some of y'all had issues and concerns around rounding rules. We have fixed both of those issues. So you should be seeing your PAs. If there's a PA in GAMUS, you should be seeing it in EVV now. Rounding rules have been implemented in EVV, and we followed the Medicare rounding rules exactly. And that means so under 8 minutes rounds down, over 8 minutes in a 15-minute unit rounds up. If you are paid in an hourly unit, which only exists in the ICWP program, less than 30 minutes rounds down, more than 30 minutes rounds up. And that's something you guys came to us and said, hey, we got to have rounding rules in here. We are not going to be able to continue to be providers without rounding rules. So we put those into the system. Another thing that we are working on is there have been some temporary rate adjustments associated with the Appendix K and the public health emergency in the now and comp waivers. You can manually update those rates in your system, but you can't. Hey, everybody, what are y'all doing on the line, taking pictures? Okay, so you can do manual rate adjustments in the system, right? But we are working on getting those public health emergency rates updated as well. That is actually in our UAT system and being tested right now. So you should be able to see that information with the updated rates for comp here. We're hopeful by Friday, but if not by Friday, first thing next week. Now let's talk before we go to the next slide about what the exceptions are for submitting claims to GAMUS as of November 1st. If you have a tier 2 ticket with the call center, if you have called the call center and the call center says, hey, I can't fix this, I'm going to open a tier 2 ticket and send it to EVV NetSmart because it's a programming issue. We capture that. For the month of October so far, we've got about 120 of those. They're all related to a couple of issues that we know about, but there are about 120 folks who have called with issues where EVV is not doing what it's supposed to be doing, and we have acknowledged that to you by giving you a tier 2 ticket. In any instance where you have a member with a tier 2 ticket that is open, you can continue to bill through GAMUS past 11/1/2021. If you have members that have a cost share or patient liability, you can continue to bill through GAMUS. Anybody who has in this, and this exists in the Community Care Services program, if you have a cost share, you can continue to bill through GAMUS because we are working through a few little glitches with the cost sharing that we should have fixed relatively soon. Also, in Now and Comp, if you have a shared service code, if you have that one worker that is working with 2 or 3 people simultaneously, those codes can continue to be billed through GAMUS post 11/1/2021. All this information is available on Banner Message, our website, and in our town hall. So please go to the EVV website and you can pull down the exceptions to the 11/1/2021 mandated billing through EVV. Next slide, please. So here's a little bit of good news. We have about 80% of our providers who have registered for EVV, and that's most of our providers, right? That's 80%. And the 20% that we have indicated that have not registered are providers that maybe they're new and they don't have any members yet. Maybe they have registered and they're no longer in that business, so they're just waiting for their ID to time out. So we're pretty confident that we have the vast majority of people who have registered for EVV. We also have 1,140 Medicaid providers who have completed a visit using EVV. So that's a lot of providers that have shown that they can do this. And this was as of last month. So these numbers have gone up way, way more than this even since last month. We also have 850 Medicaid IDs that have submitted a claim through EVV. And we have one provider that has successfully submitted 18,000 claims through the EVV solution. So the solution is working. It is capturing the federally required 6 elements that are in the Cures Act that we have to do and not get penalties. And it's working very successfully for some providers. Next slide, please. You guys have probably heard me talk a little bit about case management. One of the things that's unique to Georgia in our EVV system, and we're the only state that is doing this, is we're including our case managers. And we're doing that for a couple of reasons. One, we were very concerned about quality, and we saw EVV as a tool to increase quality. Two, we wanted to increase the communication and the visibility of what you guys do, the good work you do, to our case management agencies. So for their members, case managers will have the ability as of 11/11/2021. It was originally slated to be released on 9/16, but we did a little bit of a delay just to make sure it was perfect. But effective 11/11/2021, so just in a couple of weeks, case managers will be able to go into the EVV system and look at the services that are being delivered for their members. They will also have the ability to message you through EVV, through that dashboard inbox, that when you pull up the inbox, you can go down and see the dashboard. They will be able to email directly the agencies, the PSS, CLS agencies who work delivering these needed services. And then you, as a traditional agency, will also be able to use that function to email right back to those case managers if you need something. Say if your member has gone into the hospital and they need more hours on their PA when they get out of the hospital, you can message that provider directly from the EVV system to let them know, hey, case manager, my member is in the hospital right now, so we may need to look at that plan of care. Next slide. So let's talk about training resources. So if you are still getting ramped up and you're getting ready for next week and the 11/1 mandatory date, and you are an administrator and you're using the EVV NetSmart system, you need to make sure at a minimum you are trained for the administrative console, the mobile application, and the claims console training. At a minimum, you need to make sure you are doing those 3 trainings. If you have a caregiver or aide, they don't need to do the administrative functions because they're not doing administrative stuff and claim stuff, right? What they need to do is that mobile application training. Now, if you're using a third party and you're an administrator, you still need to complete the claims console training, but your aides aren't going to do the mobile training on NetSmart because they're going to need to do the trainings of the third-party administrator that you have chosen to go out there and purchase to help you with EVV. So just make sure that your aides are getting trained through your third party and not through TELUS if you're doing a third-party administrator. Next slide. So where can you get training? Right here at this website. And again, as Cheryl said at the beginning of the Medicaid Fair at the kickoff session, this slide deck will be posted to the GAMIS website. So you guys should have this in a couple of days. It'll be posted up there and you can go into it and use all the links. So don't feel like you have to take pictures or write anything down. This is also available on our EVV website. So you can get the information there in any of our town halls. You can go to this TELUS website and do the administrative claims mobile application that we just talked about as a minimum for an administrator, and then your aides can just do the mobile application. This is available at any time, 24/7, so you can feel free to get in and start using those training resources. Next slide. There's also a weekly Q&A session on this same training website. So you can log in and it's right there. And this is a version when you go on to that website where it shows you. The live Q&A session is a weekly session with the NetSmart staff that is open-ended. There's no PowerPoint training like this. They just literally ask the people who join, okay, what do you need to know how to do? What can we help you? What questions can we answer? So that is a weekly resource that is available to every single provider to utilize. Next slide, please. If you go into your administrative dashboard, and I was in this for 4 hours yesterday, so I'm pretty familiar with it at this point. Down on the left-hand side, when you get past all your stuff like visits and scheduling, there is a link for training. You can go into that link and pull down all the user guides. We have user guides for every application, mobile, claims processing, everything. You can pull down that training. You can print the guides to give it to your aides, or you can watch the videos that are associated. So you have full access to all of the training materials also through the administrative portal. Next slide. So let's go through a few common issues and questions. So I get a fair amount of questions about retroactive billing. What do I do if, I have a new member and that member is not showing up in EVV? So it's important to know that members will not show up in EVV until they show up in GAMUS. They have to have a current active PA in GAMUS in place, and then that PA comes across to EVV. If it's a brand new person that has never been known to the waivers before and never received service, you're going to have to document everything on paper until that person gets an active PA. Like, let's say they're a PMAO person, they're waiting to get approved for Medicaid. You'll have to document everything on paper until they're approved for Medicaid, have an active PA, and that PA comes across to EVV. Then you can go in the administrative portal and retroactively put in all of those visits to make sure that you got paid. Now, if you have a lapsed PA, let's say I have a PA that has been running for the last year, but it's 2 weeks late to get in the system. Because you already know me and I'm already in your system, you can go in and still schedule visits and complete visits for me because I'm known to you. But those visits will just remain in an unmatched status until you get an active PA. Once you get an active PA, they'll hit matched and you'll be able to move the claims through for payment. So don't worry, the retroactive billing will still be available for you. It just takes time from when GAMUS gets the PA to when it goes to MMIS. Another very important Q&A that we've heard over and over again is the GAMUS deadline for billing is noon on Friday, but the EVV deadline is 12 hours earlier. So if you want to get paid at the end of the week for your claims, you need to make sure you submit those claims by midnight on Thursday. Everything before midnight on Thursday will get paid at the end of the week. Friday and everything forward is going to get paid on the next payment cycle. So EVV, it backs up your claim submission deadline by 12 hours. Next slide, please. Medicaid members in the EVV solution. So providers can't add members. You will need to have that PA that brings folks over for them. So we already touched on this a little bit. If you are still not seeing members and you see an active PA in GAMUS, you need to call the call center to make sure that member gets added. And we'll give you those resources here in this slide in just a minute. Family caregivers, providers, go back one for me real quick. Thank you, sorry, that was my fault, not your fault. So we're still getting some question about family caregiving as designed by the Appendix K. So the Appendix K is still in effect. We will let you know once the public health emergency ends, and in plenty of time. We have been told we're going to get 90 days notice before the end of the public health emergency. We will let you know when the provisions for Appendix K are ending. We have the ability to run it out for a little period of time, even past the public health emergency. And that will give time for this temporary allowance of family caregivers for traditional caregivers to be hired. Next slide. Third-party vendor integration. So the third parties are subject to the same 11/1/2021 claim submission. So if you're using a third party, and we've got 35 or so third parties now that you can choose from. But if you're using one that isn't fully integrated, you will need to get with them to make sure they are fully integrated by 11.1. So another thing is that your aides will need to complete visits in order, and you will need to have complete visits in order to have those paid claims. So make sure you're doing your scheduling, make sure they're doing their clock in and clock out, where you have edits you need to do that on your visit screen, make sure you do that so you can rematch those claims and get them pushed over into the claim status. Next slide, please. One of the things that we are seeing a lot already, not a lot, but enough to note in a presentation, is we're seeing duplicate claims editing. And we're not seeing duplicate claims editing. Let's say Brian Dowd is your aide, that I'm getting a duplicate because I work 12 to 4 at Miss Mary's house, and then I work 4 to 8 at Mr. John's house. What we're seeing in the system is me as Brian is clocking in and clocking out at Mary's house from 12 to 4, and I'm clocking in at John's house from 2 to 6, and they don't live in the same house. I am working for one agency for Miss Mary and another agency for Mr. John. And these two agencies don't even know that this aide is clocking in and clocking out for two members at different locations at different times. If you get an edit and an error like that that says, hey, this worker's already clocked in and working somewhere else right now, you need to send that to the EVV mailbox, evv.medicaid@dch.ga.gov. Because I have staff that are out there working to investigate these and make sure that we can get them cleaned up and take appropriate action as necessary to ensure that, you know, there's not something going on there that is causing concerns. Next slide, please. This is just a graphic representation that we put in, and I'm not going to go through this too much. I'll go through a very high level as to how using a third party works. So basically, aides and caregivers use the third party that they have chosen. The EVV solution sends all that information over to NetSmart. NetSmart checks everything that the third party has sent, and then it sends all that information to GAMIS for payment. GAMIS then adjudicates the claims as it always has. So nothing has changed in the GAMIS system about adjudicating claims, including your remittance advice. You still get full remittance advice for everybody that has been claimed, and that goes back through GAMIS to the members. I mean, to the providers, sorry. Next slide, please. The members would get it on an EOB. So if you need support, we talk about the call center. Please call 1-833-701-0012 or email at this email address. There's also a chat box. We are getting as many emails as we are calls, which is unusual. It just shows the world has changed, right? So we're getting easily as many emails, if not more emails, than we get phone calls at this point for support. And I think that's a good thing because you have a documented record, but you can also call. I'm going to caution y'all from writing me first. A lot of folks write my personal email, which is fine. I don't have any problem with that. Or they write the EVV mailbox first. And if you haven't contacted the call center to try and help with your resolution, I'm just going to forward it to the call center. That's what I always do because they're the ones who document it. They open a tier 1 ticket, which they can resolve, or a tier 2 ticket. And I monitor, and different staff within DCH monitor the tier 2 tickets every single day to make sure they're moving, make sure there's no new issues, make sure that we are addressing them as quickly as we can. Some of the issues need some reprogramming, so it's taking a bit, but we absolutely positively are monitoring. So please use your call center resources. Next slide. Okay, third-party integration. Remember when I told you there were a whole bunch of third parties that are available? You can now choose from any one of these folks on this page, and I believe there's 30 on that page right now, but there's even more that are fully integrated since we set up this slide on October 1st. we've had some more people move in. Of course, the NetSmart solution on this list is the state-sponsored solution, and that solution is free of charge. So you don't have to pay anything to use the NetSmart system. But if you choose to use any of the rest of these systems, that's your choice as a provider, and they are now fully integrated with our EVV system. Next slide. These folks are very well on their way, and some of them have already been fully integrated, and we believe the rest will be fully integrated by the November 1st timeframe. Next slide. These folks are either ones that have not integrated and or they've told us they don't have any clients that are integrated. Now, there may be one, I think there's one on this list that have come back and now said they have a client, and they're very early in the process of contracting with us to get started. But if you do have one of these folks and you're using one of these folks as your third party, you need to get in touch with them and ask them, are they going to be ready by 11/1 for full integration into the NetSmart system? Next slide. Okay. So again, I want to reference here is the call center and the EVV mailbox. Please make sure you are using those. And I will do some Q&A now.
Okay, Brian, can you hear me?
Yeah, sure can.
Okay, great. I have one question here. It says, will a separate training be disseminated to support coordination, or do we need to attend the training that is currently provided?
That is a really great question, and I'm glad whoever asked it. We are going to have separate, distinct training for case management that you should start to see the second week of November. And that will include not only trainings, like specific town hall trainings to work with case managers, but it will also include toolkits that you can use so that you have them at your disposal for what you need to check, how to utilize the system. So look forward here in the next couple of weeks for not only specific training, but toolkits.
Okay, and I do see some other questions here. The next one, it says, do we still need to print out timesheets for the chart?
So nothing has changed about our documentation standard. That's another good question. Nothing's changed about our documentation standards. Our auditors will have access to the information that is in the EVV system. But if something is not captured in the EVV system, like nursing oversight, then you will need to print that out and have that information documented.
Okay, and the next question states, will we be able to bill skilled nursing visits through NetSmart?
No, skilled nursing visits are not an EVV service.
Okay. And the next question says, in regards to case managers, will we utilize one system, or will we have to learn the various systems that the providers utilize?
You'll utilize the NetSmart system and only the NetSmart system.
The next question says, hi, Brian. We are still having issues with missing offs, rounding rules, and override rates. We are having to touch every claim to make adjustments. And this is from Anita Holzenbeck.
Okay, so the rounding rules are implemented and they've been fully tested and we're seeing that we're working. So you might want to shoot me an email as to what your rounding rules still are. As I said at the beginning of the presentation, we are still working on the rate adjustment, the temporary rate adjustment associated with Appendix K for now and comp. That is in UAT right now, and we expect it to be released to production as early as Friday, as early as tomorrow, but if not tomorrow, early next week, assuming everything goes well in UAT, that will update those rates. If you have missing prior authorizations, you need to send those to the EVV mailbox that is right here. I am tracking those now. I see very, very few that are not something that is not in the system. I still get people who say, hey, I don't have a PA. And when I track it back to GAMUS, it's because there's not a PA in GAMUS or there's something funky with the PA and GAMUS. somebody saying, hey, I thought I had this many units on this PA. And when we go back, we're like, no, you don't have that service on the PA. So just the solution for that is write down the PA number that is in GAMUS, make sure that all the services you are expecting are on that PA, and then call the call center. If the call center, if it is a systems issue, they'll open a tier 2 ticket, and we do monitor those tier 2 tickets.
Okay. The next question says, do we need to ask the caregiver to write the task sheet also?
No, if it's captured, if the tasks are captured in the EVV system, it does not need to be duplicated.
Okay. It says, when EVV goes live on 11.1, are you referring to the date of service from 11.1 that needs to be submitted through EVV? What the service prior to 11.1, can we still submit the claims on the GAMUS portal?
So EVV has been live since 4.1. So I just want to make sure folks know that we have been up and running and wanting to, have providers participate since 4.1. But to answer your question, the mandate is any claims with data service post 11.1 forward are required to go through the EVV system unless there's one of those conditions that we have outlined. Then you can continue to bill through GAMUS. Prior to 11.1, we allowed you dates of service prior to 11.1. We have allowed you to bill either through GAMUS or through the EVV portal. It doesn't matter if you bill those at the end of December or wherever in your 6-month window of billing is. Dates prior to 11.1 can either go through the EVV system or through GAMUS. So we're really talking about dates of service with that requirement.
Okay. The next question states, what should we do when the system glitches? Our biggest issue is nothing showing in the app for caregivers, but on our side it is. Therefore, they are not being able to clock in. Also, there's lots of glitches with logging in, resetting passwords, etc. We will not be able to deal with all these issues happening in TELUS.
So you'll need to call the call center so it's documented. And again, we review that. It is a federal mandate, and we will be moving forward.
Okay. The next question states, also, we are not getting the help we need when sending issues to the help desk email.
Okay, if there are issues with the call center, you don't feel like you're getting issues, then you're welcome to send those to me. What we do is we pull all conversations and emails and review them, and then we take appropriate action with wherever the issue lies.
Okay. The next question says, if EVV system is only billing hours and not units, is that an EVV issue or a third party issue?
That's a third party issue. We bill by units in the EVV system. So I don't know what's going on with only hourly billing. You're welcome to call the call center so they can look at what that issue is. I think we probably need to get that documented. We do work with the third parties when folks contact us and say, hey, this is an issue. There's an integration team within EVV that then works with the third party to say, hey, here's what we see is wrong in your system.
Okay. And I'm showing one more question here. We're having several issues, and I have contacted the call center. The one that most concerns me is rejected claims. I have gotten multiple tickets and multiple answers. This is still not resolved. It is not an issue with our credentials or the T2025 procedure code. We have found that the EVV system is not sending out address as it is in GAMUS. I have not heard back, and it has been approximately 10 days.
Well, again, if you are not getting the response you feel is appropriate from the call center, you're welcome to write the EVV mailbox. And just again, with me and my open honesty, what we do is we pull that information and we isolate where the issue is. And then we take corrective action based on whether or not it's a provider issue or whether or not it is an EVV issue. So I would really, really encourage you to go ahead and send that to me directly. or
or
to
Brian?
the EVV mailbox, and we monitor those.
Okay. And I do apologize. Brian, looks like I have one more question here. Last week, the regulation department person from DCH came to do an inspection. She told us that we need to keep the task sheet. Since the since the record for the EVV reprinted did not show the task detail. So how can we print the record with the task from the EVV system?
You can export that in your reports section, but if you'll send that information directly into the EVV mailbox, we can get with HFRD and discuss that with them, because they should have open access to the information that's on EVV to see as well. And if you need training on how to pull down your reports and your information, then call the call center, and they will be able to do that. They'll be able to provide you with that training.
Okay. And another question has come in. It states, what does the missing start and or end verification means, and how do we correct this issue?
It means that you have a missing start or end date when your aide clocked in. Their GPS was likely turned off, or it was in an area where it wasn't available. So on the administrative portal, you will need to go and click that little pencil for an edit and put in the start or end date, and then put the reason code that you're doing a manual edit.
And it looks like that's all the questions that we have.
Okay, great. I would encourage you again to utilize the EVV mailbox. If you guys are not getting the response you feel like you should be getting from the EVV mailbox, from the call center mailbox information here, you are welcome to write the EVV mailbox. And like I said, we pull all the information and communication associated with that. Me and my staff members, some great people like Marilyn Ellis and Delisha Barber, go in and really dig into the details and then do the appropriate corrective action from that space to make sure we don't keep having these issues. So do let us know where you are having EVV issues. We certainly want to hold the appropriate people responsible when there are issues. So thank you for your time today. Again, thank you for your questions. They certainly help to improve and refine the process. So I hope you all have a good day and a good rest of your Medicaid fair.
Thank you.